take OBG next topic, that is mechanism of labor. So it is very important for practical exam also, and also in a board exam also. Most of the time they will ask. So in practical maybe we know, but the theories I'm going to explain you all. So what is the meaning of labor? Mechanism of labor is the series of events that takes place in the fetal head in the process of adaptation during its journey through the pelvis. So mechanism of labor is the series of events. ये मतलब means it is not a single process, but it is the series of events that will takes place in the fetal head. So these all the mechanism of labor will, whatever the process is there, that all will be occur in the fetal head in the process of adaptation during its journey through the pelvis. So the meaning of mechanism of labor means all the process will occur in the fetal head when the fetal head is going through the maternal pelvis. So this is the meaning of mechanism of labor. Next we have to know the principles of mechanism of labor. So there are mainly three principles are there. So first principle we can see the descent takes place throughout the labor. Second principle is whichever part leads and first meets the resistance of the pelvis floor will rotate forward until it come under the symphysis pubis. So means first is the descent takes place, like due to the maternal effort and uterine contraction, the descent will take place throughout the labor. Descent means the baby will come slowly baby will come to downwards. After that whichever parts leads and first meets the resistance of the pelvis, means in the pelvic area whichever part of the baby will meet first, that will be rotate forward like, and until it comes under the symphysis pubis. So whatever will come under the maternal pelvis, that will rotate until it comes to the symphysis pubis. Next, third principle is whatever emerges from the pelvis will pivot around the pubic bone. So whatever will emerge from the pelvis, emerge means whatever will pass from the pelvis will pivot means will circle around the pubic bone. These are the three principles of mechanism of labor. Next is the sixth consideration. So for normal labor, so how we will come to know the like mother is having normal labor, like baby is normally born. So it will be sixth consideration. The lie is longitudinal, the presenting part is vertex, the position is left occipital anterior, the attitude is universal flexion, denominator is the occiput, the presenting part is the posterior area of the rigid parietal bone. Then after this we have cardinal movements. So there are 10 cardinal movements. This is I will first I have list down. After that I will one by one I will explain you. First cardinal movement is engagement, then descent, flexion, internal rotation of the head, crowning of head, extension of head, restitution, internal rotation of shoulder, external rotation of head, lateral flexion of the body. So this all are you can see these all are the 10 principles, cardinal movements during the mechanism of labor. So what all are these? What is the engagement? These all I will explain one by one. So first one is engagement. So during this mechanism, the occiput touches the iliopectoral eminence. So in the maternal pelvis, there is a one point is there is iliopectoral eminence. So that will the baby's occiput, baby's head will be touches the iliopectoral eminence of maternal pelvis. Then the diameter is suboccipitofrontal. Then the occiput diameter is suboccipitofrontal. That is 10 centimeter, the largest diameter. Then after the descent, so due to maternal effort and uterine contraction, descent takes place. So how descent will takes place? So due to maternal effort and uterine contraction. Next is flexion. So flexion of the head takes place. During the flexion of head, diameter is suboccipital pragmatic, that is 9.5 centimeter. So during the flexion of head, the head will be flexed towards the and then it will be the diameter will be suboccipitobrachmatic. Once the head will be flexed inside inward, the brachma will be the brachma means that what is that, pragmatic, the sutures, where the sutures will joined together, and that will form the pragmatic, that is 9.5 centimeter. After that, internal rotation of the head, according to principle, whichever part touches the pelvis floor will rotate 1/8 of the circle. Internal rotation of the head takes place. Here the head is in anterior posterior diameter and shoulder is in oblique diameter. So according to principle, whatever will touches the pelvic floor will rotate 1/8 of the circle, and then the internal rotation of the head takes place due to that. And then here the anterior posterior diameter and shoulder is an oblique diameter. So head will be in anterior posterior like this diameter, anterior posterior, oblique diameter, oblique means like this oblique diameter. Then crowning. So next is crowning. It is the term used when the occipital prominence escapes under the symphysis pubis. So crowning means when the passes, that head is the baby's head is passing through the symphysis pubis, and the head is no longer recede between the uterine contraction. There is no longer the head will be between the uterine contraction. Here the diameter is biparietal, that is 9.5 centimeter. The diameter is visible at the vulval outlet. So the biparietal diameter, it will come down due to the crowning, and then the diameter will be the visible at the vulvar outlet, outside the like perineal, it will visible. Next is extension of head. It is the moment by which the flexion of head is undone. Like here first flexion of head was took place in third point, so that will be the now undone. Now it will be extension. Before folded, now it will be come out, like extension means totally it will be extend out. The nape of the neck, here the nape of the neck will sweeps the perineum, symphysis pubis, nape of the neck sweeps the symphysis pubis, and chin, face and sinciput sweeps the perineum. Next is restitution. Okay, so restitution, this is the turning of head to undo the twist in the neck that took place during the internal rotation of head. So when it was an internal rotation of head in the fourth point, internal rotation of head was took place, there it got the twisted. So now it is undo the twisting. In restitution they are undoing the twisting which were twisted in the internal rotation of head. This movement reveals whether the position is right or left, and midwife is more likely to manage the birth of the shoulder without perineal laceration. So when the head is twisting, they will come to know which side the baby is there, usually right side or left side. Like that, if right side, the head will be untwist in the right side. If left side, head will twist in left side. So according to that, the midwife will be come to know like whether the shoulder which side. So it is easy to deliver the baby. Next is internal rotation of head, shoulder, internal rotation of the shoulder. So it is the similar movement as the internal rotation of the head. How the head was internally rotated, like that only shoulder also internally rotate. The shoulder is in a left occipital anterior position, or in the left oblique diameter of the pelvic cavity. They will be oblique diameter on the left side. The shoulder rotates at the 1/8 circle takes place. Okay, the shoulder rotation will takes place in the 1/8 of the circle. 1/8 of the circle will rotate. Anterior shoulder escapes the symphysis pubis. Posterior shoulder sweeps the perineum. So anterior shoulder will escape the symphysis pubis, and posterior shoulder sweeps the perineum. Next is the external rotation of the head. It is the turning of the head which accompany with the internal rotation of the shoulder, and always in the same direction as in restitution. Next is lateral flexion of the body. The body of the baby comes out by lateral flexion to the maternal abdomen. So the body of baby finally it will come out in the lateral flexion and to the maternal abdomen. Thank you.